Good afternoon and welcome to the Seminole County COVID-19 press conference, updating everyone. I appreciate those tuning in today as well as the news media being here to help get the message out on behalf of the county commissioners and the 7 cities of Seminole County. We welcome you here today. I want to give you some updates, also talk to you about some new developments, and also give you an overview of what we're constantly monitoring. As of right now, we have 194 positive cases. We continue to monitor that. I think we continue to see that through the region as testing increases. We also are currently working, Mr. Alan Harris, Emergency Management Director, is working with our health department on having an additional testing site coming online in the near future. This is going to be one that's similar to the Orange County Center, which allows for drive-up type testing. We're continuing to work with our neighboring counties. In fact, myself as well as several of the mayors in the region have a teleconference tomorrow. We'll be talking to many of the hospital groups and other health officials and understanding as we prepare for further impacts as this starts to unfold. I want everybody to remember that during this time of everybody being locked up at home or staying home as much as you can, we understand there's some emotional and mental issues and impacts related to this. We had some controversies with our boat ramps this weekend that forced us to close those. Those were related to, unfortunately, gathering of numerous people in mass groups on the river, which is an absolute violation of not only the CDC guidelines, general good practice during this pandemic, as well as Seminole County and the state ordinances that have been put out on the emergency measures. One thing that we're starting to see develop, we can't emphasize enough, is we're going to give you a little bit of data on what we're seeing on percentages of those people that are testing positive, which was somewhat concerning to me. I think it will be to most people, which is first, our youngest patient is age 19. 19% of our positive cases are under the age of 29. We have the largest percentage, which is 52% of our positive cases are individuals aged 30 to 60. We all know that the elderly and those with immune system compromises, we've always been told those will be the most impacted. What we're seeing there is we're not seeing the impact to the magnitude that we thought. 27% of those are over age 60. So the point being is, I cannot emphasize enough the need to continue to social distance. One thing we'd like to see people start to consider, we start to observe entire families, by example, going to Publix or one of the shopping centers to get supplies. We would ask and urge you, pick one person out of the family to do your shopping. There's no need to take the whole family. Continue your social distancing. Look for options of drive-up pickups at many of the vendors and box stores are providing, as well as groceries being delivered to your home. So we would urge you to make sure that you start following those guidelines. For the young people, what I can tell you is this is a real deal. This is not time to get together and party. This is not time to think it's something made up. It's a serious situation, so we can't urge enough that we hope and pray that the young people take this seriously. We understand it may not be as impactful if you get the virus, but remember, you cannot pass it to the elder or those with immune system compromises or others with underlying health concerns. So although you may not be particularly affected from a sickness and symptoms, you may be passing it through the community. So we urge you to do the social distancing measures, take the personal responsibility, and do what's right. We also understand that the business community continues to be impacted. This is a tragic scenario for them as well when it comes to business and employees. We also continue to see layoffs, people losing their jobs. We also understand that we're going to start to see more people with needs as far as food, as far as housing and so forth. We're working not only with our community partners, but we're also working with a lot of the retail outlets and understanding what they may have to be able to provide to help shelter and feed these folks. Would also ask you to keep in mind the following contact information. You can always call 407-665-0000, which is a citizen's hotline for any information, or to report some things such as spam emails that are soliciting information from some of our elderly. If you see something, say something. That's where you can report it. Also, stay alert at prepareseminole.org. You can see information on the internet there as well, but you can also interact through our Facebook. Alan Harris and his group in emergency management do a couple of Facebook Live presentations. You can also go to the Seminole County Facebook page where you'll continue to see updates. I know we've had a lot of questions about traveling. We've had a lot of questions about what's going on at the airports, and today we have Diane Cruz from the Sanford Orlando International Airport, which is the region's second largest airport here in the Central Florida region. So Diane's here today to talk a little bit about what they're seeing at the airport and help answer some questions from there. So Diane, welcome and thank you for being here.
Good afternoon. Thank you for inviting me to be here. I need to say that first and foremost, the health and safety of our passengers, our employees, our tenants, and partners continues to be the top priority at the Orlando-Sanford International Airport. We are continually monitoring the coronavirus pandemic, and we're working closely with local, state, and federal officials, the FAA, and the CDC to ensure that SFB remains safe. According to guidance that we received from the FAA just this past Saturday, the FAA's primary concern is that federally obligated airports like Orlando-Sanford International remain safe and open to the traveling public and to aircraft. Particularly during this public health emergency, airports play an essential role in transporting medical and emergency equipment and personnel, and the FAA absolutely continues to expect that all airports will operate safely and stay open. We all know this is a critical time for our nation, and it's a critical time for our nation's airports as well. Yesterday, April 5th, a total of 122,029 passengers flew through U.S. commercial service airports, compared to 2,462,929 on the same day last year. That's a reduction of 95% in total commercial air traffic. So the airport continues to remain open for military and general aviation as well as commercial service, though with greatly reduced numbers, and flights are subject to cancellations and changes. It's very important that passengers contact their airline directly with any questions regarding travel itineraries. At present, the Sanford Airport Authority employees are working from home wherever possible. Other employees have been placed on reduced rotational schedules to provide minimum operational coverage in non-critical positions. At-risk employees have been furloughed with pay. Critical positions in airport operations and public safety are being appropriately maintained to ensure our mission of keeping the airport safe and open. Great caution is being exercised in all positions to safeguard the health and safety of our personnel, including the use of PPE where appropriate, enhanced cleaning of the terminal facility, and the practice of CDC guidelines to prevent the spread of the COVID-19 virus. To date, no health screening of arriving passengers has been conducted at Orlando-Sanford International Airport, although we have been in frequent contact and continue to be in frequent contact with the Florida Department of Transportation as well as the Department of Health. We are fully prepared to accommodate screening if the decision is made to implement those procedures at our airport. We are also a landlord to many businesses in the Sanford Airport Commerce Park, and we have remained in communication with those tenants, providing them with the guidance and direction that we've received by Seminole County via the executive order, as well as the CARES Act. In addition to the economic relief for individuals and businesses, the CARES Act will provide $10 billion in relief funding for our nation's airports. We are presently awaiting details from the FAA as to how and when those funds will be made available. However, be assured that any funds received will be managed prudently by the Sanford Airport so that we can maintain our self-sufficiency that's required by our grant assurances and prepare us for the uncertainty in the days ahead. Again, the health and safety of our passengers, our employees, our tenants, and our partners remains our top priority. Thank you very much.
Thank you, Diane, and thank you for being such a great partner with Seminole County. This is just another example of the economic impacts that this community is suffering, not only from the traveling and the tourists. You know, many of our folks that fly in and out of Orlando International Airport are impacted by the closing of the theme parks, so on and so forth. So we understand that, but right now this is most important for the community health. So everybody needs to be focused on keeping safe, keeping healthy, and please, by all means, be aware of your surroundings, understanding what 6 foot is, do the right thing. For the most part, our community has been fantastic in doing what they should be doing and taking that personal responsibility. We want to thank our businesses for also doing their part. We're in constant communication with a lot of the large box stores who send us daily updates or weekly updates telling us new measures that they're deploying. By example, Walmart has now reduced nationwide. We have the 30% maximum occupancy. They've now dropped theirs to 20%. So this is just an example of the business community working with the government entities in trying to do the most and best possible methods to keep the public safe. So with that, we'll be happy to take any questions you might have. At this juncture, there have been none levied as far as monetary citations. There have been multiple interactions on the behalf of our sheriff and our law enforcement. Those have been educational in nature and helping people understand these are the guidelines, these are the rules, you must disperse and stay away. Do what you're supposed to do. And in most part, we've had nobody that's really said, hey, you know, we're not listening to that, and you know, go ahead and write us a ticket. Thus far, we're thankful for that.
Diane, if you could, step up to the podium for a second. So, I know that I've heard from several people who head up airports that a lot of medical supplies, crucial things, in a cargo sense, fly in. It's always been my understanding that it's passenger planes, but there's also, like, you know, packages and different types of commerce also fly in the cargo hold. If there are planes flying with virtually nobody on them, do those flights still continue? I mean, do those, say, I don't know if it's even happening, say there's a flight scheduled and nobody buys a ticket, does the cargo still come in on an empty jet?
So at present, we are not flying any cargo in the hold of the aircraft that are coming into Orlando-Sanford. And as far as the reduction in passengers, the load factor, that is up to the airline as to whether or not they want to fly or cancel.
Okay. So when like FedEx or Amazon, when they piggyback on a commercial airliner, that's something that the airlines using your facility don't do?
That's correct.
Okay.
Could you address how, to date, health screenings have been conducted at the Sanford Airport? Can you explain why that has happened and if there are possible future plans for that?
Okay, so the screening of passengers who were coming in from certain areas of the country, especially the greater metropolitan area of New York, was a determination made by the state of Florida, and it was an initiative that they were partnering with the Department of Health, and it was their decision as to which airports that screening would take place at. It has not been determined to, first of all, we don't have flights from those particular airports, so that's part of it, but as we progress, we are made aware that it may happen, but we have not been contacted yet.
As far as you know, has there been any positive cases of COVID-19, whether with TSA screening officials or any employees of the airport, there at the airport?
To my knowledge, we don't have any documented cases at the airport.
Sir, I know late last week there were concerns about people who have been sick going out while
Yes.
they're still sick. As some of the sick folks are out there are getting towards the end of their window and are getting where they should be cleared of
Sure.
illness again. Is there anything they need to do to get good with the county before they can go back out?
Good question. So they must get a release from a medical doctor saying that they are free to go and they've been released from the COVID-19 quarantine. That is also monitored by our health department, who must get that release, which then also feeds it through our emergency management team here at the county. So we're aware. But daily, our people are calling and checking up on those that are positive to try to make sure that they're intact and staying there. But they have to have a medical release before they can actually be allowed to get out in the public and move around.
And that can come from a doctor?
Has to come from a medical professional, that's correct.
But are those daily calls happening to your knowledge?
Yes, our emergency management people are calling those people who are quarantined, not only that have tested positive, but those that are quarantined because maybe they came in contact with somebody positive, to make sure that their needs are being met, by example, meals, or they have some medication need, or they have a need to see a doctor, or any other need. I think Alan, we had a discussion last week, we had an interesting scenario where one of the patients that we had a refrigerator that failed. And of course, then not being able to go, how do you get a refrigerator delivered to this person? Can you just call up one of the box stores and say, hey, bring me a refrigerator? Alan's group helped coordinate that so that people with the proper PPEs were in place to intercept the delivery, work with the family of those individuals to get the refrigerator in and allow them to remove the defective refrigerator. I mean, as you can imagine, these stories could be endless when you're told you have to stay at home. What do you do when you have a refrigerator fail or some other event that otherwise we would just get in our vehicle and go get a new one or have one delivered? So these are the kinds of things that Alan's group are working with every day, calling. Of course, again, we have no method to, quote, track these people every waking moment. So the surveillance, we have to ask, in some cases, as we heard last week, neighbors have actually called and said, hey, we know our neighbor was tested and we're not sure they should be out running around. Then Alan's group has to get involved with law enforcement and those health officials to take the appropriate action. Anything else?
Chairman Zembower, a question from Dan with News 13. He's asking about the boat ramps. Why punish everyone by closing the boat ramps? Instead, why not leave the boat ramps open and find the violators?
So a couple things there. One, we learned very late last week that there had actually been an organized fishing tournament, that somebody decided we're going to go have a big fishing tournament out here, which is something we don't want to happen, having all these people gather for a fishing tournament. But secondly, here's the big issue that we're all concerned with. Our first responders, whether that be our EMS people, our fire, or our law enforcement people, we're very careful that we have the least amount of interaction as possible to continually put our first responders, our law enforcement people, in a position where they're interacting with large groups where they themselves could contract the virus, then loading the health officials or the healthcare workers even more, and loading unnecessarily the hospital capacities. So what we have to do is, Alan's group monitors that. A decision has to be made, and in that case where that large group have been gathered, FWC as well as our sheriff had already warned on several occasions for these people to disperse, not only these but others. When they failed to do so, it left us no other option but to look out for the best of public safety, which was close the boat ramps. All right. Well, we appreciate again on behalf of the county commissioners here in Seminole County and the 7 cities, thank you all for attending today and be safe.